consult on our INGO partners and see how we can mitigate the impact on them as well. Honorable Senators, this is the submission from the minister.
Thank you very much, Madam Minister.
Distinguished colleagues, you have heard from the Minister of Health.
We didn't have a discussion round. We'll listen to each of them before going to Q&A. I think so. What do you think? Okay. I think we'll just take note and listen to each other. Thank you. So it's over to education.
Thank you, Madam Chair and honorable senators. We are going to present a synopsis of the impact on the education sector occasioned by the withdrawal of USAID. We know that USAID has been a crucial partner in supporting Liberia's educational sector transition and reform. USAID's support has been instrumental in enhancing institutional capacity, tackling structural issues, and expanding access to high-quality education. USAID's current support to the sector is valued at over $139 million United States dollars.
To education?
Yes. That is broken down into 4 projects that are directly implemented by USAID.
That was annually?
No. Over a year period, I will give you the period for the different projects. So USAID has four ongoing projects that impacts the sector. The first project is the test project, transforming educational system for teachers and students. That project started in 2021, September 2021, and will end in September 2026. That's a $21 million project. USAID operates in 6 counties: Bon, Bassa, Lofa, Margibi, Mossoraro, and Nima. That project builds the capacity of selected public, private, and faith-based institutions, train primary and early childhood educators and teachers, and enhance knowledge and strengthen capacity. It's a test project that is implemented by USAID. It started in 2021. It's expected to end in 2026. Then we have the ISA project. The ISA project is a $23 million project. ISA is Educational System Strengthening Activity.
Is that paper distributed also?
Sorry?
Share your presentation.
We have to make some edits, but we can give you the audited version.
Yeah.
Sure.
Because we want to follow up.
Sure. Please.
Sergeant, in agriculture, if you have similar
So I was discussing the ISA project. The ISA project runs from 2023 to 2028. It's a $23 million project operated by USAID again. It operates in 6 counties. It's intended to improve educational governance and accountability and strengthening decentralized system. The third project, which was just launched in the 4th quarter of last year, is Liberia Foundational Skills Activity, LFSA. That project is supposed to run from 2024 to 2029. It's a $75 million project that had not started up to the time the freeze was placed on USAID activity. It's intended to increase foundational learning, especially literacy, foundational literacy. So that project has not started. Spending on that project had not started because it was just launched in Q4. Then the final project is the ILA, Incentivized Learning Activity. That's a $20 million project that was launched by USAID in 2023. It's supposed to be up to 2028, and it's a $20 million project. So that amounts to the $39 million project that USAID is supposed to operate, supposed to implement in the sector. So you will see that that covers the period from 2021 to 2028. To date, USAID reports that is spent $56,113,583, and it has undisbursed amount for 2025 That was 28,588,375 up and to the time where the freeze was placed. So, Honorable Senator, those are the summaries of the projects that are implemented by USAID in the sector, and those are the numbers. Thank you very much.
Thank you. Mr. Agriculture, are you ready?
Yes.
You have copies also?
Unfortunately, my essay is pretty long, so it should be a short one.
Okay.
Well, good morning, Honorable Senators. And on behalf of the Minister of Agriculture and Dr. Senator Mucha, who is out of the country, I'm here to proxy for him and to give some information, clarity on the pause of the USAID and support to the agriculture sector. Our government has always been grateful to the United States and to the USAID aids in terms of its enormous historical support to the agriculture sector. Notwithstanding the current pause from the U.S. government to the agriculture sector by the USAID has a trickle-down effect, not only with regards to the USAID assistance, but also it affects us when it comes to FAO support and also that of UNDP support. The agriculture sector, as you all know, we have developed what we call the National Agricultural Development Plan. And that plan is synonymously aligned with some of the support that the USAID had made some pledges for. Some of the pledges that they have made is like the pledge of $24.8 million pledge to support the agricultural sector. And from that pledge, we have received only 6.4 million thus far. List of the projects undertaken by the USAID funding. For instance, the food security, nutrition, and resilience activity in Liberia, the agribusiness incubator and development activity, the agribusiness sustainable activity, and that of the construction of a research and conservation center. All of these are still pending. The previous pledge was 24.6 million, and what we have received thus far is 6.8 million, as I said. The effects of the funding halt on the agriculture sector. Over 36 USD in pledge funding is on hold. Disruption of the agribusiness development activity to encourage mechanized farming and value addition is also on hold. Disruption of food security initiatives in the interior of the nation to reduce poverty and improve food security is also on hold based on this pause that the U.S. have imposed. Disruption of the establishment of new agencies such as the Seed Development and Certification Agency. As you know, Honorable Senators, there are certain legislation that were passed, one that has to do with plant protection and one that has to do with the fertilization and regulatory agency. Those agencies were part of what the USAID have pledged for us to activate in terms of funding. As a result of this pause, those agencies are now going to be affected. However, as resilient as we are at the Ministry of Agriculture, we are now trying to align our National Development Plan with a new roadmap that will try to at least somehow cocktail some of these development agenda that we have. But thus far, this is where we are as a ministry. Thank you.
Thank you very much. We have some of our colleagues join while you are presenting. We give them the opportunity to introduce themselves and continue. Thank you.
My name is Nomini Ishbatiwa from Great Group. Member of the committee.
I'm Abraham Darius Dilla. I represent Monterey County. I'm a member of the Education and Health Committees for the purpose of this hearing.
Thank you. So we're now sorry.
The truth.
Sorry.
My name is Jonathan Bon Charles Sobe. I represent the people of River G and I'm a member of this committee, Health Committee.
So before we go, Chair, before we go to, so
Use your mic.
the Minister from Agriculture, it means that the same way the other institution presented some information, you don't have time.
Yes, I do have it, and I apologize for my essay has it, and he will soon make it available.
Madam Chair, I think then we should pause for him until the information. Please keep us.
So while we await his SA to bring the document, can we move on to
Yeah, I think.
the Ministry of Finance?
Yeah, before we move on.
It's the same problem.
But just before we move on,
Okay.
any of the entities here have scripted information for us. Let us submit it now, so that we can be going through it to inform ourselves.
We have
What is
to.
my submitted?
And yeah, I got
Education and
I
health.
have education.
And health.
What is health? I don't have health.
I have the.
What's education?
Education just.
Yeah.
Education
So where
just.
is it?
You don't get the education, man. They ask you about this.
Maybe it wasn't enough. Let somebody come and run some campus. Yeah. They run some campus.
You look at this.
Yeah. What agriculture?
He said he doesn't have.
Let me excuse the place.
Yes, it is. I mean,
Let me excuse the place. I didn't follow the respect the Sunday for the place. He coming for serious hearing and then he say, let's take a document. But the chair, let me excuse the place and to go get the document. Let the acting minister of agriculture excuse this place until he get the document. So I have health and education. What finance?
Finance, I have it here, I can still give you a soft copy at the print.
Come again? How do we inform ourselves when we finish reading what you brought?
I can still share right now by WhatsApp or email.
When you have done that,
But we get our computers here, we get one we have to read this document so that we can interactively.
is that a long presentation?
It's not a long presentation.
no, but if you have a shot, you come in talk of figures, you come in talk of impact.
Let me put it in our shop.
So,
There's a soft copy.
Madam Chair, I told you to postpone this hearing and get it properly prepared. They use a thing, the last 14 for the joke where they can't read figures before us here, and then we just ask questions out of the blue.
So maybe since the health and education ministries have provided some write-out, we could start questioning, asking questions why the other two go and get their
Okay, I think I can consider or yield to that.
Thank
But finance and agriculture will not say anything until they produce, get all the descriptive information from which we can ask questions or inform ourselves.
So, Mr. Deputy Minister, I think if yes, please go down in the office and get it printed, then you come back and continue. In the meantime, we can start.
If you, Mr. Minister, if you get your own on the computer, my office is right there. My secretary is there. You can work with him.
Okay, I can. Thank you so much.
Yes, just right.
All right, thank you.
Yeah, please take them to my office. My office. Yeah.
So can we continue with the other two ministers?
Yeah,
Okay.
fair for
Okay, so you listen to the presentation and you have them with you. The floor is now open for questions where you need some clarity and or comments. Thank you. Who want to go first? Okay, Senator Sir Joseph, you have the floor.
Thank you, Madam Chair and colleagues. I want to say thank you for coming and in submitting your presentation. like to start with health. We listened to you and looking at your presentations, and also a proposal that you submitted on what you think we should do. Have you looked at the total amount in terms of the total amount of money that you asking us to look at locally? What do you think could be the total gap in terms of dollars and cents? Yeah, we can interact.
Honorable Senator, we are still in the process of analyzing the total gap. We've been able to get figures for the FIRA G2G, so we understand that gap. We also understand some of the gap for supply chain, but we are still analyzing because the gap affects other projects, other NGOs that are implementing or USAID supported projects. So we are still analyzing to get the total impact. But as a quick analysis, we were able to analyze and see the impact directly on the G2G project and on the supply chain as we analyze other gaps.
So part of what USAID is supporting Liberia, does that cover medication, not life-saving medication, but other medications?
Yes, USAID particularly supports malaria medication. Through the PMI project, they support malaria. They are the main donors for malaria medication.
Okay. And then I think government have been making some efforts in making sure that most especially the legislature will budget, through the budget will make appropriation. So how much of our appropriation capture total medication budgets?
Okay,
Even the controller can speak to.
Yeah. So from the national budget, the total of 4.7 million was approved by the legislature for essential medication. And in addition to the 4.7 million, there was a 1.6 million that was allocated for the community pharmacy program. That is what we call it used to be called the revolving drug fund. So if you combine the two, it will give you a total of 6.3 million.
Is that the 2024 budget or the
2025,
okay.
The current budget.
Okay.
Yeah, thank you.
So, 2024 budget, do you still have, regarding through the PPCC agency, do you have some companies that you sign agreement with to supply you drugs? Have all of these companies supply you the medication?
The disbursement of fund is still ongoing. So some have supplied 100%, and some of them, the deliveries are still ongoing.
For 2024 budget?
Yeah, for 2024.
So how much of 2024 budget of medications that you're still waiting for those companies that haven't supplied us yet?
So from the
I'm asking this question because it's a tough time.
Yeah.
So wherever you get other small support, other leftover, we need to keep track of them to make sure that we are good, because health is very important. We don't want any health emergency situation. Yeah.
So from the 2024 budget, we have a little close to $1 million outstanding that is still ongoing from the national budget.
What do you mean $1 million?
$1 million worth of supplies. Yeah, medical drugs and medical supplies.
Okay. Did you give any other UN agency $2 million to supply medication?
From the government budget? No.
From which budget?
That was from support from the World Bank project.
Okay.
And those medications have been procured, they have started to arrive in country. But for our Q1 distribution, we have supplies that are targeted to go out. So any additional supplies through the World Bank support will target it for Q2. But we know that it will be inadequate because we also need the malaria medications and the other medications from TB, HIV that needs to be added. Yes.
So, but the World Bank support is still there, right?
It's still there.
For 2025?
The commodities were supposed to come in 2024. So they are just starting to arrive.
Okay,
Yes.
for World Bank?
Yeah, from our World Bank support.
Okay. How about the RDS when they receive 1.2?
I think it was what he was making reference to, that it's still outstanding. They've been able to supply a quantity of the medications, but the others are still outstanding.
RDS has supplied, RDS hasn't supplied yet.
They supply some.
Okay.
Yeah.
Yeah, that was the portion I was referring to. I
Okay,
said the
portion.
supply is ongoing, it's not concluded yet. So once that delivery is complete, we can be able to.
So do you think if you capture all that we appropriate, all of the appropriation for 2024, do you think that those supplies can take you for 2025? Because
No, sir.
so, so
It cannot take us for 2025.
because you have, let's say you have 6 million for 2025, right? And then we have an outstanding of almost 2 to 3 million dollars for medication. So if those supplies come, can you use the 6 million for life-saving drugs or for all of the malaria drugs? That's where I'm going.
Yeah, certainly we rationalize, but for us to tell you that it will suffice for the rest of the year is equated to tell you that the moratorium has no impact on this year, and will be deceiving you to say that. So I think the essence of our assembly here is to show to you the impact that our country, or specifically the health sector, is facing. So to answer you directly, to say that we will get enough supply of drugs this year with that delay in the supply of last year will be deceiving.
So let me just get clarity on that. The drugs from last year's procurement activities that have started arriving is short of malaria, HIV, and the rest. Is that the case?
That is the case.
So what we have now, we said is available for the first quarter, right?
Yes.
So I think the question in my mind should be whether that buffer that we have for the first quarter can provide buffer for these essential drugs while we're looking at different donors to intervene. Is that?
We had calculated, Madam Senator, that the supplies that we received at the end of last year, we had apportioned them for our first quarter, taking into consideration that the procurement that was ongoing in the last quarter will have been supplied to our supply chain system. So our first quarter was going to be assured. But the supplies are still coming in. We don't have the complete. But what we have, we can supply for this first quarter. Our issue is the second quarter. We do not have supplies yet for second quarter. The malaria medications should have been arriving, I think, in this month or next month. We are not sure. That container is on the high seas. Whether it's allowed to land, whether will be able to clear it, to use it, we do not know. So we have to make provision for drugs and medical supplies from our second quarter within August.
Yeah, so just a point. I think, just as you mentioned, correctly mentioned, the emphasis for the first quarter will be on the HIV and AIDS, malaria, and TB medication. Because it is a partner that have been providing them, and so the ministry have been practically concentrating on the essential medication aspect. So it means that if this were to hold, the aspect of having the malaria, HIV and AIDS and TB drugs readily available will become an issue. So that is our concern, and I think the senator just rightly said that. Thank you.
Well, Senator, may I make a point on this, that the government has allocated 6.3 million in this 2025 fiscal year for drugs to be bought for the health sector. But our total need for drugs in the health sector comes to almost 14 to 15 million per year. The partners subsidize what the government is providing. We are saying that the USAID is our major donor. USAID support also affects the well-being, the global fund. The USAID support is 60% of the support for the global fund. So the impact will actually affect other donors who also support our health system. So we are calculating USAID impact, but we also have to take into consideration the impact on other partners that support us. Thank you.
Thank you. No, I think you stay on the phone. You don't.
No, anybody can come in.
Oh, okay.
You can borrow.
Okay, Senator General come in and then Senator Patrick will follow.
Thank you. My acting minister from the health. Last year, 2024, this legislature and the government appropriated 80 million to the health sector. 2025 budget is 85 million, correct?
Yeah.
Correct?
Yes, the sector, yeah.
Good. Apart from this, 85 million appropriated. So let's go back to 2024. 80 million in 2024. We have next month to conclude the fiscal period of 2024. After March, anything that was from 2024 will be lapsed by fiscal policy, correct? Correct. Out of the 80 million, when it comes to fiscal author, how much the ministry has received? Because 80 million on paper, in cash, from foreign ministry disbursement to date, how much the ministry has received? Before we come to 2025, then we come to the usage issue. The computer.
Yeah. All right, Senator. The 80 million, it covers the entire sector.
Yeah, I know.
Yeah, that includes the health ministry, KFK, all of the other institutions in the sector.
All right.
So what we have available for the Ministry of Health was 61.8 million.
What do you mean when you have available? What was
I mean, what was approved? The final budget for the Ministry of Health was
in 2024?
Yeah, 2024.
60 million?
Yes.
Talking about when all of the other
And the whole sector had a case.
when you move, you
Another question I'm asking. Then you have to have it.
Yeah.
And I have document here.
Yeah.
And I found have ministry body document.
Yeah.
I'm reading the document from the budget. 2023, 2024, this legislature and the government budgeted and approved 80 million for the health sector, correct?
Yeah, for the sector.
Good. Out of the 80 million, how much have been disbursed to date? And the question I'm asking you.
Yeah, so we can speak specifically to the Ministry of Health, and then maybe at a later date we can provide data for the sector.
So the Ministry of Health represents the health sector, correct?
Agreed.
And to date, as we said, the Ministry of Health cannot tell me how much has been disbursed out of the 80 million because there is money plenty on paper, or it appears to be plenty on paper, or it is nothing when it's only on paper. It is something, it can be tracked, it can be accounted for when it is disbursed. How much have you received from this amount?
Thank you.
You the controller.
Yeah, Honorable Senator, the reason I'm making emphasis to the Ministry of Health budget is that is where our authority lies.
Okay.
With the Ministry of Health.
Okay.
So we've not been able to confirm from other institutions in the sector what the actual expenditure are.
So when no drug or medical equipment at JFK, Redemption, or any other hospital, send not the ministry itself.
No, the reason I'm saying this is that on the basis of the government accounting system, when funds are allotted under the government accounting system is considered as expenditure. So sometimes these funds may not necessarily be disbursed, but once they get into financial budget, is classified as expenditure. So it means that individual institutions will have to go back to the drawing board to determine
what role does the Ministry of Health play when it comes to ensuring that health facilities across the country are funded and operational? Since you are the head of the health sector.
Honorable Senator,
yes,
we engage with Ministry of Finance. Once we have information that our entities on our health sector have issues with funding based on the allotment in the budget, we engage with the Ministry of Finance advocating for release of allotments to those institutions.
Do you commit to this committee that you will get all of this?
Senator,
yes, sir.
Excuse me, sir. Madam Minister,
yes,
you are the controller. I want you to be fair to this hearing.
Please use your mic.
I want you to be fair to this hearing. We are here to solve a problem. Are you telling us that 2024 that ended, the outturned that you will use to come to us to ask for more money, you don't know? That's what the man is asking for. Let us know what is your outturn, even though we appropriated this money, 10,000 of the 10,000 we gave you. How much you received? Are you seeing even when Jason F. Doe is asking for its report or their report? You don't know, it doesn't, even then you say, okay, let's come to the ministry alone. You don't even know the ministry is outturn?
Honorable Senator, there's one misunderstanding here, and that makes me to provide that clarity. When you talk about 18 billion to the health sector, it's not necessarily going to the health facility, hospital, clinic.
Excuse me, sir, please.
You are welcome.
Sir, we know the 18 million salary, everything is up for health, but all that. It's there for medical facilities and like all these institutions under the health ministry that will quality the sector. Correct?
True.
What's the misunderstanding?
So the misunderstanding
Yeah,
here is when you're talking about drugs, now all these entities handle the issue of drugs. So when you
Excuse me, Mr. Minister, I don't think the senator is talking about drugs. We understand that the budget process has stages. It comes from formulation, it goes to implementation, and then reporting. Sometimes when the budget is approved, during the implementation, there are hurdles. Some institutions, some ministries get allotted or appropriated certain amount, but they don't access it until the budget lapses. This is the question. Why don't you answer that clear question?
All right, so let me give you the estimated figure. So the estimated figure is 52,636,758 is the result of the outturn for fiscal year 2024 budget for the health sector.
So that means the government through the foreign ministry executive has not disbursed about 25 million yet
To the sector.
to the sector.
Yeah, this is an edited figure, and it's
Why you didn't edit it before me? When the president delivered his annual message, the president said all medical facilities across the country, public medical facilities across the country have received medical supplies and drugs to date. True? Yes. Only for us to find out from the health facilities across the country that it is not entirely true. And I believe what the president read from the health sector came from the health ministry.
Only one second now.
Yeah, please.
I think what the president read was correct.
Okay.
The Ministry of Health has a distribution cycle. We distribute drugs every 3 months. As you deliver the drugs are used in the health facility. So we calculate the amount of drugs that you need for 3 months, and we give a buffer. So by the time you use your buffer, we have resupply. Ministry of Health was able to supply 4 rounds of that cycle. We are at the point now where the facilities are using their buffer. By the end of January, the buffer comes to an end. We are supposed to be able to resupply in January so that you go to the health facility, you will see no lapse of drugs.
As we speak, drugging all the public.
Can I answer that?
I've got your answer already.
Yes, but I'm saying I want to bring to your attention the impact of this USAID suspension. As we were about to do our distribution, the USAID sent a mandate for the closure of the project that is responsible to operate the central medical schools. We have not been able to carry those out.
Okay, so we'll take note of that and make our case with the committee and the chair. I ask those questions because there are times where we appropriate funding, budgetary support for this institution. There are times they don't receive the funding. We don't know because you don't tell us. There are times where, in fact, the government goes beyond what was appropriated when you see from the fiscal option. For instance, we appropriated 33.1 million for the University of Liberia. In the alternate University of Liberia got 35 million. When the university was at 16-20 million, they were trying to open. We took it in 2024 from 24 million to 33 million. And the government even went ahead to pay 35 million to the university. Still, it did not open in 2024, the last part of 2024. This legislature was playing as though we had made no effort to get the university open. When you, the sector institutions, are not performing, it is troubling for us. So my question on the USAID thing, 2025, we are budgeted to 85 million. So that means the government aspect to the budget, we have increased the health sector from 80 million to 85 million. What is the total figure of USAID in intervention in the health sector? The total figure, you the head of the health sector, all these interventions USAID is making, one year USAID have provided $16 million for malaria prevention, 20 million for this other HIV thing. What is the total figure of the intervention of USAID so we know the gap that we have to fund? Question.
Thank you, Honorable Senator. In the document that we handed out, we analyzed it over a period of time. What was the total investment that USAID made into our sector? But I just want to look at the year 2024. The USAID had a planned disbursement of 27 million into our health sector. They disbursed 36 million into the health sector in 2024. So we need to analyze clearly what that investment is in 2025. But over the period of time, we've been able to analyze all the projects that are planned. Some of the projects are planned up to 2031.
The
Some of them.
$26 million that USAID provided 2024, was there budgetary support or to the sectors or to the institution themselves directly? Was there budgetary support? Did it pass through the national budget? Or
Some of it.
Some of it?
Some of it, like the G2G or FARA project, that is one project. It's disbursed to the Ministry of Finance, then to the Ministry of Health.
Okay.
But most of the support is off budget.
So that means when we budgeted 80 million for instance, and the USAID came with other interventions saying 40-50 million outside the budget. That means there's additional 50 million intervention in the health sector in addition to what the budget appropriates, correct?
Yes, our analysis is correct.
Okay.
Let me just add a little point, the CMO. USAID support, it comes in various forms. Some come directly through the ministry, as Ministry of Health. Some of them are done through other organizations, international NGOs, local NGOs, and the likes. So it's spread across, and not necessarily through the government budget. So you will see a portion of it going to other international organizations. That will be the information we provided to you. We have allocations by implementing partners and funding and fund flow. You will see the name of different institutions there. We have ICF Micro Incorporated.
Where are you reading from? Where are you reading from? Mr. Computer?
Yes, sir.
Where are you reading from? We don't have it before us.
Honorable Senator, we did not give the breakdown, but we had done an analysis, and that is what he's reading.
Analysis breakdown. So what is it? How can we inform ourselves?
We did the analysis to be able to give you a summary. We can definitely share that analysis with you.
No, we don't want a summary. We want a total breakdown so that we know the manner of intervention that we have to make and the impact of this withdrawal by USAID. If USAID said they gave out 20 million to fight disease, for instance, how much of that money goes to fighting disease and how much goes to personnel from USAID back from that money? Because by the time they go here, USAID gave Liberia 20 million. The thing that whole 20 million come to Liberia through the health ministry and they get anything to do it. So that the personnel costs, the consultancy costs can almost carry half of the money. You need to be clear with this kind of information so that we know what to do, how to intervene, and what have you. We just saw one tweet from Elon Musk about 17 million being withheld from Liberia for tax policy advice. Who's advising on our tax policy and how much that advisor or Google advisor taking from that 17 million? We need to know all these things. So you can know that 17 million here and somebody play with it. Madam Chair, you for now. Madam Chair. Thank you, Senator. Yes, Senator.
Thank you. Let me follow up with my colleague. I think he has done well. To the Minister of Health, I think my information and my understanding is that most of the support that is given, when an amount is given, it goes over a period of some years. It's not just 1 year sharp. Now, this committee is thinking about how we can mitigate every year because we cannot find that total gap that will go through the period. So, how can we help for an S year? For instance, we're talking about 2025. By information, if I'm correct, is that when the controller was talking, he said the intervention of USAID on an annual basis to the Ministry of Health could be 14 million. Is it true?
Yeah, to the Ministry of Health.
Yeah, Ministry of
Health. They are funding that. Yeah.
Exactly so. If it is true.
So, Honorable Senator, let me just provide a point. Right now we have issue with the Central Medicine Store, the CMS. It used to be the National Drug Service. That place is being managed by the World Food Program, and World Food Program is being finalized by the USAID. It was being finalized by USAID up to the point of this process.
After all of that is what you calculated.
Yeah, so that is a direct, infusion into the process.
Indeed.
In addition to the G to G agreement.
No,
Thank you.
I'm saying G to G, P to P, Y to Y. All of that you put it together. And you said, what? We will be missing on an annual basis to the Ministry of Health will be about 14 million because just we are considering only on an annual basis because our budget is annual. At the end of this year, we will go back on the drawing board and talk about 2026. So the difference for 2026 will be talk about during 2026 budget formulation. That's my understanding. If it is so, the question that Senator did not ask, what is the budget that you have? You say 80 million. Of the 80 million, what was the hard point? You said 50 plus 50. If that's 30 million, are you saying if we prevail on the Ministry of Finance, because we can't formulate budget, pass it, give Ministry of Health 50 million, then you go get them only 50. And the error 30 is outstanding. Of course, you have not told us that the Ministry of Health, even though you Ministry of Finance, you gave us the budget, but they didn't give us the balance money. Our health sectors are crying for drugs. If that 30 million is made to pay by Ministry of Finance, are you saying we don't have any problem?
Honorable Senator, I cannot sit here and tell you this. The government's allotment to the sector is a component of our entire health sector of expenditure. Out-of-pocket expenditure is 64%. Expenditure by the government, I think it's about 11-12%. The other percent comes from donors. The donors provide or use funding to our health sector. For
we are focusing on USAID now.
Yes.
USAID. I'm saying about 30 million that's what you're supposed to receive from the government was not given to you, even though you ran, you had some problems because the total amount was not given. But can we now look eternally? Can we look eternally as a government? You're supposed to receive 80. You receive only 50. That balance 30. If we give it and we ask you to go back on the drawing board to fill the gaps that have been left because of the help from USAID, can that provide at least alternative solution until USAID can decide?
It can help, Senator.
Yes, it can help, Senator. And in addition to that, I think there will be an additional need of 21 million because our HIV and AIDS, TB and malaria are national programs that are supposed to be the responsibility of the government. But because of the intervention of our partners, highly sponsored by the USAID, right? That's why we don't want to leave them out of this equation to say we'll focus only on the 14 million. Because that 14 million will be compensation for the G to G component of the agreement with the USAID, and then the additional 1.4 million will be for sustaining the Central Medicine Store. But then what happens, right, if this situation continues to our national programs involving HIV and AIDS, TB and malaria, TB and malaria. So those are also components that we have.
Mr. Comprera, we have a problem here. We're eating jello rice every day because we have supporter. The supporter say, no, I'm not giving you what I was going to give you. So we come internal, we come home. Mommy, we're eating jello rice. And you know that this is what we have. Is it possible that the Ministry of Health, because when the 80 million was given you, you disaggregated it to your needs, to the various components of the ministry. That 80 million that was not fully paid by the Ministry of Finance, the Senate can engage the Ministry of Finance, and then you, that gap, that will use 30 that left unpaid, is now used, go back to the components of the ministry and make sure those gaps are filled. On tight constraints, because we don't have any source. Our constraints, our fiscal space as a government is limited. Can you help us use the balance that was not paid, even though you ran a ministry that was unpaid, and we find solution to this problem? This is what I am asking.
Yes, Honorable Senator, that would be a very cogent intervention.
Yes.
I think we need to look at our existing funding and see how we can optimize it. And your suggestion will go a long way to helping us. Definitely.
Thank you.
Thank you, sir.
Okay, so let me really also ask, who selects the beneficiary counties? Is it the donor or you?
Together, we developed the agreement on the government and the USAID. And USAID projects, they want the maximum impact. So initially, they targeted our 5 highly populated counties. And then later on, they expanded to additional counties. So the project wanted to target the majority of our population. And so those 8 counties constitute about 83% of our population. That's why we targeted those counties.
I will come at that. Is there any partner, even though we were talking about going internally now looking, but is there any partner from, since you be dealing with your partners, that really can be approached through you by the government to also assist, that you're thinking about? Is there any other partner among your partners that can help us, work with us, while we looking critically at the halt by the USAID?
The ministry has reached out to our partners. In fact, as soon as the incident occurred, we convened our close partners, UN organizations, other bilateral partners. We have reached out to all of them. But up to this point, we don't have any firm commitments, but there is a willingness to fill in the gaps as we identify them. So we are in discussion with those partners.
Okay, thank you. To conclude, even though my colleagues there were thinking where I was going, I'm thinking, I observed, the Minister of Health, Minister of Agriculture, all of you, most instances leave out the disadvantaged, the impoverished counties, and only focus on specific sector of the country, which is indeed unfair to the other counties. Those counties are depopulated because of your attitude. Because when you go there, nothing. So they go to where everybody now thinking, let's go to Bonn, let's go stay there, let's go to Lima, let's go stay there, let's go to all the counties are unattended to. Very unfair. Thank you very much.
Thank you, Senator. We will now turn to Senator Sigwin.
No, I'm passing.
You okay?
Yeah.
Okay. You want to come in? Okay, let everybody know we have. And thank you, thank you for the presentation. I just wanted to piggyback on a few things that you mentioned. Actually, let me say that the purpose for this meeting is to put all of us on the same page, because we are a government. We will go to places. We will discuss the impact of this USAID withdrawal or suspension, whatever it is. We should give with the total information that we can deliver at those different interactions. When we speak as legislators, especially those in health. When the health minister gets there, when your controller and any of your officials gets there, the numbers should be around the same. The vision should be the same. That will make us look like a responsible government. This is the purpose. So we beg you, we need something more detailed than this. Senator Joseph, you finished? You were done?
No,
you go closely with health and then we'll move.
You closely with health?
Yeah.
Okay, so I would say for the health sector, I mean, your report is good. Thank you for what you guys been doing. But you need to monitor more in terms of the supplies in the various facilities. But when you have a tour and then people complaining no medication is not good, for us here that sit here will make appropriation, also you are working. So you have to focus on that. I don't think companies or those people should take money and they don't bring in the drugs on time. Well, if those drugs come and they are expired, what do? Who is responsible for that money? So going forward, I don't think they should be paid until they deliver the drugs. They should take that action. And when those drugs come and they expire, they should pay back, because this is 2024 budget year. Now we come to receive it 2025 budget year. Up to now the drugs are not here. It's not fair to the people of Liberia. That money you pay. I know you trusted them, but if they cannot live up to that agreement, I don't think you can do business with them. So we can go to education or agriculture.
Before we go there, just making closing remarks for health. Maybe we can excuse them while we move to the other.
Yeah.
Thank you, because they gotta go back.
So
thank you very much.
We can keep you haven't that much for you.
Minister of Finance is
So he should present now why health is here, right?
Yeah, why health.
Okay, thank you. I think that makes a lot of sense. And that's the reason why we invited these people. Because what we notice when elderly people come here, I don't know whether you're afraid of something, nobody speaks about the hurdles that are within accessing monies appropriated for your operation. And this is key things that people will come and complain, or will come to hear nobody talks about it. So it's difficult for us to help you to engage this sector administrators to make sure that you have the money available in time to do your work. So let's listen to the Ministry of Finance, and then before we excuse the Ministry of Health, please. You brought your copy? Did I get it?
Not yet, Madam Chair.
What is the problem now?
We have listed it by distinguished members of the Senate.
Madam Chair, we made a decision. The Finance Minister will not speak here until he gave us the scripted information. This is disrespectful and would not be good.
But they offer you somewhere to print your presentation. What happened?
Madam Chair, I think from on the floor right now, you can see clearly that when it comes to, we've done analysis, and those analysis, in terms of detailed analysis we've done, we've also corroborated information from what we've gotten from USAID. The Finance Ministry, as the financial authority of the country, need to make sure that all the information are collated and exact and to the point. Any public speech is going to be the final speech from the government. And now we've submitted this to the president, and we need to make sure that one inspector will come to the legislature with information. So the PowerPoint was just to just give overview, but we cannot give any detailed information here.
So the overview, we did not ask for detail, we asked for the overview presentation that you brought. So that as you are presenting, we can follow.
That is not an official.
So what do you mean to all official? Madam Chair, the minister should, in fact, we should start holding people in contempt when they're doing these things. He came deliberately to give up on official things, so what he wanted all here for to do what?
Senator,
I'm talking to the chair. He offered me give up on official.
So what did the letter say? Did you receive the letter? Did you read it?
I did receive the letter the minister sent to me.
And what did the letter ask for?
There's a reason why we appear not to disrespect the Senate, because in as much as you have work in progress waiting for presidential approval, you can stay away. And that's the reason why we've come here. So to make it an official position to give the Ministry of Finance, it definitely.
You should document that he is saying document it to the Senate that you're asking for latitude of time officially. You can't come here and say that take out and then you can't give an official version. Suppose we rely on it. This is public.
Senator, that's the reason why we are saying that officials.
So what do you want to present
after
today?
consultation with the president.
Let's say you present it. It's not
What do you want to present today?
We are having.
Because whatever you present is being recorded by the press.
Yeah, but that's what I'm saying. We will be having meeting with the president before the Friday, and when all the information is vetted, we definitely give copy to the Senate.
So, Madam Minister, Mr. Minister, you know, like in your presence before you left, the Minister of Health made a presentation and they talked about gap in experience during the 2024 disbursement period. It is only you that will give us a counter proposal on that, whether that's true or it's not true. That is why you are key to all of them. So if you are saying that you are not ready, then it means that, in fact, discussing with them, all of that needs to be, because when we talk to them, we can come to you. Is it true? What is your information on them? And what is it? In the absence of that, we not get a clear picture of what is happening. Like, we just talked to the Minister of Health. If your outturn was only 50, and confirmed by the ministry that they spend the money, and we got 30 outstanding, that 30 can be used to mitigate the problem we got. And that confirmation has to come from you. So if you are saying the hearing should be postponed, because you got to say, when we are talking to them, it's like budget. Period. When you there, when they talk, you talk. When they talk, you talk. The solution of this problem, you are the key person. Are you advising us to cut off the hearing until you get ready?
You see, we don't need the advice. We have to take decision, colleague. We have to take decision. We cited these land institutions, and they are officially informed about what they're coming to do in line with our oversight. And the Minister of Finance comes not ready. We will not sit here for any unofficial submission. And I will suggest to the chair and the committee that we shift this hearing to next Monday, so that all these institutions can come back synchronized along with the Minister of Finance. And we want them to come tell us the impact of this USAID withdrawal and what we need to do as the government through the Senate or the legislature.
How can it be mitigated?
How can it, yeah. Whether we look at salary and benefit holistically across government, where we can take some fat from to fill the gap. What is the impact of USAID program? When USAID get $10, what are they bringing personnel to take $6 and only $4 leave or $10 leave on the contract name? We need all this critical information so we know how to, because if USAID bringing $10 and $6 for their personnel, then and they're spending $4, then it means we actually need $4 to fill some gap. Maybe all the kind of technical issues we need to know. So I don't think we should entertain any unofficial submission from the Ministry of Finance, especially that we put them on our own here. It's a disrespect to this body, will not entertain.
Thank you very much. Colleagues, that is the suggestion on the floor. I don't know. What's your take?
Well, I think the Ministry of Finance have asked that they can get themselves prepared and do submission. So let them do that. We can give them time. But we already started with health. But the effort comes from I think agriculture. We can listen to agriculture, and then
In education.
and education.
So we're going to come by and be one ourselves.
So you have presentation figures to submit to us that don't need to be clarified by Ministry of Finance?
I can say that for a fact, because the Ministry of Finance has a final authority over figures. But I've submitted copies of my figures.
No, when you say
I can't say that. Honorable Senator, I can't say that.
okay. Then since there is a case, so we may have will come back again Monday?
They will have to come back.
That is my concern. Maybe they will not come in this number because of the work they have to do. They just need to go back and pull all of of the comments and come up with something more.
So the Ministry of Finance will give
detailed.
her how much money they have given to help. They will give her the author and everything. So the Ministry of Finance will do that. Have already did a
They
presentation.
already did their presentation.
Moses, we can keep the CMO here.
I think we should do a motion
Yeah.
with the joint committee here. Do a motion and then we conclude on it.
Yeah.
I think the entire panel here should come. Let us not come and be discussing finance ministry and then
Exactly.
there are an issue that has to do with health that needs clarification. And the health will not be here any or not in its entirety. So let everybody come back. It forms part of their working process.
Exactly.
So let us be here. Let everybody come. Let it remain on our oath and we call it back next Monday. Oh, now on our oath? Okay, well.
When they come down, then they will take their oath.
So let's put it on our oath and discharge them. Eh? No, let's put them on our oath and discharge them on our oath of till the next hearing, which is scheduled for Monday.
So let's get a motion to do that.
I move. Thank you.
As we move and second that, and postpone this hearing to a later date. Did we say Monday?
Monday.
Are we sure of Monday?
The finance minister said it's submitting on Friday.
Today is Wednesday, so they will be ready. If that's it.
They're meeting the president Friday to do submission, and they will have hard copy of submission for us by Monday.
What about Tuesday after session?
I don't have problem. I don't have problem.
I think Monday. Okay.
Monday, okay.
Yeah.
Okay, to reconvene on Monday, we'll communicate the time to you.
Special people.
The meeting is hereby.
Oh, they're not on our own.
Yeah, the tower gone already.
Yeah?
The tower gone
Motion
already.
for reconsideration.
You want to put it on our own before